What a beautiful time with Dr. Adesanya Adewale. This medical doctor is a gynecologist that knows the job well. He's so good in everything he does. I tell you the truth. And he's a specialist, a consultant. Today, he's going to be in the house and he's going to be giving us, the food that we need for fertility. You know that thing is key in everybody's life. Whether you are a man or you're a woman, you want to have babies. So this is the topic. As hot as it is, he's going to give it to us. Are you not interested? Of course, I know that you want to be there. You want to listen, you want to watch. You want to hear what he has to say. Because you know that everything he's going to say, at least, if not 3, 1 will be for you to handle that infertility issues. Or you might not have any issue with infertility, but you might have someone that you will listen to what he says and you will give to the person that this was what you heard, that the person should put to work, and the person is going to have a beautiful result. I mean that person that has infertility issue, problem, you can be the solution. You can be the one to solve it for the person. Are you willing to stay tuned and listen to what this doctor, beautiful, wonderful gynecologist has to say? He's actually there for you. I can't wait to see you there. Thank you. Come on board. Thank you.
The men are always hiding their head. They're always, so that's why it appears like women are more when it comes to issue of infertility.
Come to health. Health is key. Don't joke with it. Don't just go to anyone you feel you can go to. It's gonna make you waste a lot of money, and at the end of the day, look. Hey, make welcome with me, Dr. Adewale Adesanya, a gynecologist, very good in his job. Will help you to get it going in life. Dr. Adesanya, thank you for being here. Welcome to Successful Media. We're happy to have you anyway.
It's always a pleasure to be with you, to have this kind of celebration.
You know, you make me laugh a lot. Today is another day. We are here to make people smile because we are here to put a smile on people's faces. You know that, as usual.
As a doctor, we also prescribe smile once in a while. It's a form of medicine.
I like that.
So my dad used to say, laugh and grow fat.
Oh, good. It's good to know you understand the part of laughter. I know that's what is part of what you medical people dish out to people when
Absolutely.
they come in for consultations and all that, which is good. Okay, right now, a quick one. To be a medical doctor, a specialist, a consultant, it's not an overnight thing. We would love if you can tell us the story behind. I know you don't want me to say great achievement, but I'm going to say that because it's actually a great achievement. Great achievements. We want to hear that story. Thank you.
Thank you very much, Favor. Well, to be a medical doctor, like every other discipline, because I don't really believe that it's really, a lot of people will tell you it's hard, difficult. There is any discipline you choose, once you are determined with dedication and you're willing to persevere when there are challenges here and there show, then you can definitely be assured of success at the end of the day. So becoming a medical doctor requires a lot of training, a lot of practice, a lot of self drilling, But above all, you need to be focused and to be determined, especially if you want to go through the route of becoming a specialist, like you talk about, the specialty aspect and what eventually make you become a consultant. So story is very long, but the summary is that you need to be determined, you need to be focused, and you need to persevere. A lot of challenges that will definitely most definitely face you.
Wow. Focus is a thing that must be there, because if you're not focused, you can easily,
Derail.
fall off, you just derail and just do the wrong thing.
Absolutely.
I mean, that's a very good one. Okay, as a gynecology with many years of experience,
Thank you.
what is infertility?
Wow. Okay, that's a very good topic. Is it good or not good? I don't know, but is a topic that's very important in our environment.
Yeah.
So infertility in a nutshell is inability of a couple to achieve conception, or as the case may be, to achieve pregnancy. Note, regular unprotected sex for a whole year before you can start talking about infertility. I am trying to emphasize this because of our mothers, our fathers, our uncles, in-laws, friends, the society that start gazing at the new bride tummy after 1 week of marriage.
Exactly.
That's common in our environment. So before you can tag someone as so fertile or trying to achieve conception, they must have been having regular unprotected sex for more than a year.
And it's a couple.
And it's a couple thing.
Yeah.
Not a single thing.
We all heard it, that infertility, is that what it says it is? So when you're going through that, you know what it is now. It is said that infertility is most common in women than it is in men. What would you say about this commonly made statements?
Wow, it's most common. Well, it is said by who? By the society again?
Yeah.
Is there any facts to back that up? Is there any statistic that back that up? That is not correct.
Good.
So like I said, while trying to explain what fertility is, it's a couple's thing. And I made bold to tell you that out of 100, 30 cases are absolutely as a result of male factor.
You can tell me that again.
Male contributing 30%. That is what is backed up by the statistic.
Wow.
Then also you can see female contributing 30%.
Okay.
And in another 30%, you will find some causes in the man and you find some causes in the woman, which we refer to as combined causes. And there is this 10% again. People must note that they are yet to get pregnant, but there is nothing wrong with the two of them.
Wow.
So everybody should note that there is this 10% again that will not still get pregnant after a year, even though there is nothing wrong with the man, nothing wrong with the woman, which we call unexplained infertility. Yes, there are studies here and there trying to dig deep to know why that is the situation, but as it stands, there is still 10% that will have regular unprotected sex yet will not achieve conception. I said 30% is contributed by men, 30% contributed by women, and another 30% is contributed by both combined together. Like that's why we call it evaluation of infertile couple. We investigate the two at the same time. Although a lot of things are happening these days, the world is evolving. That you find the lady coming to seek investigation to check her fertility. But standard is because it takes two to tango. So we evaluate the two together.
But you know, most times the men always say they don't have issues. Even the family of the men says it's the wife that has the problem.
So that is why I said the reason why it is usually viewed like that is it is very easy for you to ask a guy, have you impregnated anybody before? They say, yes, when I was in school. What you use to evaluate infertility is to ask stories surrounding your being, your reproductive organs, and all of that. And one of the information we want to get is, have you impregnated someone before? Okay. Have you had infection before? Have you done this? So I'm trying to get somewhere. It's easy for a guy to say, oh, 2 ladies got pregnant for me. 3 ladies got pregnant for me. And they removed it. Easily assume that that is capable. It's an assumption.
Yeah, okay.
And it's difficult for a lady to be asked, have you been pregnant before? When you have not been pregnant before, you have not been pregnant before.
Yeah.
Are you getting it?
Yeah.
And again, even if you have been pregnant before, it is well known and established that being pregnant the first time doesn't mean that you can still get pregnant again.
Second time.
Especially if there are issues following that pregnancy.
Oh, okay.
So, and who seek medical attention or more when you compare the two genders is the women.
The women.
The men are always hiding their head. They're always, so that's why it appears like, okay, women are more when it comes to issue of infertility. But facts backing this up suggest equal contribution for both gender. 30 from men, 30 from women, and 30 from combined effort. Then there is 10 that is unexplained.
So for me, I strongly believe that for a couple, both of them should go see the medical doctor, the gynecologist together. So they do a kind of examination to know where the problem is coming from. Because with that, the solution, come out. They can say, the gynecology can say, okay, young man, this is the problem I can see with you. Or young woman, this is the problem I can see with you. So you handle it together. So I think, for me, that would be my own advice.
The funniest thing is, you hear a lot of things these days, and a lot of people, well, I would say until we separate the business of health, or we separate health from business, it's difficult to separate them, but we should have a line where we draw the line that, at this point, let's concentrate more on health than the business angle. A lot of people are exploiting, they're extorting because of the overwhelming ignorance in our society when it comes to health. By the time you start selling supplements, say pregnant this, pregnant that, fertility, there is a clear path to reproduction. The female and the male. If you have not diagnosed a problem, it's difficult to treat it.
Yeah.
It's difficult for you to pick one supplement and say, I've been looking for pregnancy. You don't even know if it's a male factor, you don't know if it's a female factor, you don't know if it's combined, if you don't know if it's among the unexplained, then you start swallowing some supplement, or if it's on the other side, traditional birth attendant, no diagnosis, you're just drinking, assuming that the drug, the supplement, or whatever the concoction is, will have a magic one that will address ovarian, address tuber, address the womb, address, even if there is a zoospermia, lack of sperm, bring it on and they start fighting and they start.
Wow.
The level of ignorance makes it easy for people to exploit people, to take advantage of people. There is no shortcut to it. If there is a challenge with conception, it is very, very compulsory for the husband and the wife to consult together to see the doctor. I'm not talking about the issue of, I'm a single mother, I want to have a baby, I want to do...
No, we're talking about couples here.
So
this is for couples, not for any other, category?
No, when you're talking about infertility,
Yeah.
ability to achieve conception.
Yeah.
All right, let's go.
So we're talking about infertility. It's applicable to everybody, male and female. Yeah, but your explanation on what you just said is to couples, right?
Okay.
But what you just said now is narrowing down to couples, those who are married.
Yes.
Yeah, that's what I'm saying.
Well,
is that?
You know, our society now, they are making pregnancy a prerequisite.
Yeah, but they do that, but that doesn't mean that it has to be promoted. It's not right.
We're not promoting it. We're just being realistic with our analysis and our discussion. So, are there people, are they supposed to do it? Are there people who make pregnancy a prerequisite to, we are in the clinic, we are the one that see the patient, we are the one that see the client. You see people come. Are you married? No. Do you have a fiance? Yes. So you want to check, what are you trying to check? Where is your fiance? Are we going to check? No, I just want to check myself because I want to know if I can get pregnant, if I'm fertile. Do you understand?
Yeah.
Fertility is not supposed to be addressed. Yes, there can be factor with the female. You can address the female factor in the absence of the man. If you go back together, if there is a male factor, all your efforts are.
You don't have to get pregnant for someone is not married to you to determine if you are fertile. There are other tests that I believe one can take to know the level of your fertility. If you have any issue with infertility,
we are not validating that decision. We are not discussing. We are not validating it.
Okay.
We are highlighting what is happening in the society.
Okay.
How it is not supposed to be, and I'm highlighting. So we're not debating it. It's not. I'm not validating it. It's not supposed to be.
Okay.
It's not supposed to be a test too.
Okay. All right. Okay. It is said that infertility is most common with women than it is with men.
Okay.
How true is that?
So, like I said, that wasn't a statement of fact. That wasn't backed up by any fact. They are just conjectures, but in the society, and for reasons. What is backed by fact with statistics is the fact that may contribute about 30%. That means men contribute about 30% during our investigation. Female contribute another 30% to infertility, while in 30% of cases you have both man and woman contributing to infertility, while there will be another 10% that will not still get pregnant after a whole year of regular unprotected sex, and you cannot even find anything on the man or the woman as a cause. This category of people, or this 10%, we say they are unexplained infertility. So although there are advancements in technology, there are a lot of deeper evaluation, deeper investigation, trying to know that, okay, why do we still have this set of people? The tubes are fine, every other thing we check, they're fine. Why are they still struggling to get pregnant? But that's another technical area. But the fact remains, the major area that we look at, you will discover in man, everything is fine. In woman, everything is fine. Yet, and they are still having regular intercourse. Yet they are not achieving conception.
Wow. Oh, I believe it is so, because I've met a couple of women who said they've been to the doctor, they couldn't find any problem. In fact, the doctor told them that they are fine, there's no issue, but they still haven't had, to conceive. Well, it's okay. Such things, is only God that can undo them anyway. God can change things and make things to work. I believe it, because what man cannot do, if the medical doctor can't find any problem and they tell you that you are fine, yet the problem is still there, as in you are saying that there is a problem. You've done all the examination, doctor says no problem, then you go to God and say, God, you are the one that created me. I know that you're going to make everything fine. And I want to tell you, some women, they have done that. They just go back to God and just be trusting God, praying God, and they conceive.
Yes, it's not impossible.
Yeah.
And also, I may like to state at this point that there are a lot of other intricate factors that disturb conception.
They like what?
Like the societal pressure,
Oh,
the anxiety,
okay.
the stress. There's a way they disturb,
Okay.
disrupt the system that prevents you from even properly timing your intercourse, from achieving conception. What you said, I've actually had a patient before that I was treating, and after medication, they try so many things, they try stimulation. They say, okay, just calm down, relax. You guys are anxious. Can you people go on holiday? Can you have fun? Can you just relax, take this off your mind for 3 months, 4 months? Since you guys are still relatively young. Lo and behold, it was during this free picnic vacation time that they got pregnant.
Wow.
So anxiety.
Okay.
So, and again, there are times that you say, I've done tests. I used to tell some people that, look, you do test, everything is fine. The husband is in Abuja, the wife is in Lagos. How often do you have sex? Once in a month. Once. There's nothing wrong with the two of them.
Okay.
But at the same time, there's something wrong with both of them.
Why? Because they're not always together.
Because they are not doing the main thing that will produce the pregnancy.
So that means what you're saying now, distance is not supposed to be there when there needs to be conception.
A lot of factors, society factor can bring distance, but you must be determined. If you are intentional, you want to. So it is said that before you can start doing tests up and down, you're stressing yourself. You must have seen that you are doing what is right, which includes having regular, adequate sexual intercourse. You know, it can be regular too, once in a month. It's still regular. If it's once in a month, it's still regular. But it has to be adequate. What do we define as adequate? 3 to 5 times in a week.
Okay.
And that affords you the opportunity to hit your ovulation period. Assuming you can't time it, you don't know your ovulation period. You know, once you do 3 to 5 times in a week, the chances of missing your ovulation period is slim.
You married couple, you can hear what the gynecologist has just said as an advice for you to follow his instruction. Yeah, what are the leading causes of infertility in women?
So now, I like to, as much as possible, break this down so that people can understand.
Good.
Fertility, when you talk about conception, there are like I said earlier on, it takes 2 to tango.
Oh yeah.
There is a contribution from the man. There is a contribution from the woman.
Exactly.
The man produce and release, and what the man produce and release as a journey, you know. And if anything disturbs that journey, it will contribute to infertility.
Wow.
If the destination is disturbed, it will contribute to infertility. Now let's take it again. The female, you know, there are ovaries. One, on either side.
Okay.
Then there is a tiny part called a tube.
Okay.
And there is a womb. The male womb proper, that's the corpus that we talk about.
Yeah.
Then that connects to the cervix, what we call the window of the womb, the opening of the womb, and that connects to the vagina.
Okay.
All this structure I mentioned must be very good for someone to get pregnant.
Wow.
So when you are looking for the causes, you look around this area. When you talk about leading cause, you see, even you have followed the sentiment in the society because you said leading cause in women. You have ignored the men. Okay,
we can also say leading cause in women and in men. Let's put it that way. Now you explain that.
Let me just answer the question the way you put it.
Okay,
now, I started with ovary. When there are ovarian problems, then a woman can struggle to conceive.
Okay.
ovarian problem varies from, anovulatory cycles, meaning that you are having your cycle without producing egg.
Wow.
Polycystic ovarian syndrome, that one brings along with it other problems apart from the ovarian. Instead of the ovary to produce egg, it just gathers cysts, month in, month on month. So you have multiple cysts and now produce some hormone that cause some other issues in your body. So now ovarian problems. Now the tube that connects the ovary to the womb, where the egg that is produced when fertilized is supposed to pass to get back to the womb, is very tiny, very friable. Tuber factor is one of the leading causes of infertility among females.
Okay.
Now, what are the things that cause tuber factor?
That's what I just wanted to ask you.
That's a very big topic.
Just give us a little
now the one
information about that.
One that I find avoidable. That is very common.
Did you say avoidable?
Yes.
Okay.
That is common among our ladies.
Okay.
Starting from the teenage age is vaginal discharge.
Okay.
Vaginal infection.
Okay.
It's a common practice in our environment, which is very bad. When you have, it's just this. Of course,
when you say in our environment, I think you should say among female gender. When you say in our environment, are you talking about?
It's in our environment. It's not among all female. Abroad,
okay.
The person that has vaginal discharge goes to the hospital.
Oh, okay.
Nigeria, our environment, person has vaginal discharge, they go to the chemist.
Wow.
They go to the pharmacy.
They ask a
nurse. And one funny thing about antibiotics is they have a way of working to give you some subtle relief.
Not killing the.
So it might even kill some, but it doesn't. There's what we call alpha clearance. If it doesn't clear a significant portion of the organism, the load, the amount, the number of organisms you have, you may feel some relief. It's not coming again. It's
then
not
after a while to come back again in
there is what we call ascending infection. So the ones that are left behind start multiplying again. Then they start going up to go and disturb the organs we are talking about. So, and among the organs we talked about, the one that is most friable is the tube. Before you know it, it has lost its function. So when it loses function, then you start struggling because the sperm cannot easily pass across it again and come back to settle in the womb. And as tiny as it is, if it's not functional, natural conception becomes difficult.
So how can?
But there's always a way out of that.
Okay, what's the way out?
The way out should be assisted reproductive technique, the technique that makes you bypass that blocked road.
Okay, now I want to say this. For the infection that comes into people's body that causes the discharge you talked about, how can they eradicate it from their body? Because you just said something about them going to the chemist or just taking some medications and they just believe that it's gone, and then after a while it's like it comes back with a full blow, right? So how can that be avoided? How can they deal with it completely?
It's a very simple thing.
Okay.
I keep saying this. You asked me earlier on, how difficult it is to go to medical school to do this.
Yeah.
Now, when you assume that it's a difficult journey to get to that point, how come the society believe that, the people that go through that stress or that went through that stress to learn how to manage a condition, some people will just come and learn 6 months and start treating those conditions.
I understand what you're talking about.
Listen, so it's a simple thing. It happens in this kind of in our environment. Whenever you have any condition, you seek the care from the appropriate personnel.
And that's why you people are there, the medical doctors, the gynecologists.
So there is no I mean, if you are not asking, it's like telling me, how do you manage a case of vaginal infection? I don't know if I can quickly talk about this common practice in our environment. It's becoming very, annoying. Someone is sick. Are you getting, or you feel some kind of way? And the next thing is, you walk down your street to a lab. You say,
without first going to your doctor to tell you what to go check for.
I've done one test, and the lab now say, oh yeah, go and look for doctor and show it to me.
I know what you're saying.
So now, it's a very funny practice, and it is very common in our. Look, it's not about exposure, it's not about knowledge, it's not about how eloquent you are, it's not about the level of education or how wealthy. It's a common practice across all kids. So you go through the back, and when everything has gone wrong, you now come back to the doctor.
And then you spend more money.
So I have I have something I do on YouTube where I talk about go LD and save lots of money. If you go through the right channel, you spend less.
Yeah, that's
it appears to you like you're going to spend more. They collect money for this, they collect money for that, but eventually you are going to spend less.
Yeah. And again, if you go early.
If you go,
because if you wait for the situation to deteriorate to a certain stage, you might have to spend so much. You spend your fortune.
So one of the contributing factors to that is the fear of spending. Like, I will spend a lot. They are too expensive in the hospital. So you delay, trying all sorts before you make that decision. And eventually, get worse. You spend more. I haven't spent or wasted. I don't call it spend.
Yeah.
I haven't wasted lots of money. So the proper route is you see a doctor who ask you a lot of questions. Some people even get pissed off when you ask them questions. They think you're just teasing them or you're just asking for fun. I don't know.
Because they feel you should just know what is going on.
Like Babalao,
a magic.
So there are stories, then there are things we check. Then when we check, it informs us of the what we call it presumptive diagnosis. It tells us the list of possible diagnoses. Then it tells us what to do to pinpoint which is it. You cannot treat any condition except you know the diagnosis.
That's true.
Are you getting it?
Yeah.
So I did a small video on YouTube, like the difference between taking drugs and treating a condition is years apart, miles apart. Consuming drugs, it can be a part of treatment, but it is not a treatment. Okay, I have malaria and typhoid. You went to take okay, what has the malaria caused in your body? Do you even know? Do you have an idea? So if you swallow chemical that clears the malaria in your system, if there's a sequelae of that malaria, how do you manage it? How do you know? Then more often than not, you use some funny drugs, then after 2, 3, 4, 5 weeks, you come back again with the same symptoms.
Yeah,
you now come and see.
It's going to be coming again.
So let's just go through the route. Don't be scared. There are a lot of HMOs. There are a lot of opportunity government hospitals. Yes, crowd challenges, but it's good to. Health is not a place you go on a daily basis or regularly. Sacrifice, get the best for yourself, then go back to your life. Do you understand?
Well spoken, well said by the gynecologist. I know you all are listening and you can, resonate with what he's saying. It's good to undo things early enough through the right direction, the right source. Don't cut corners. When it comes to health is key. Don't joke with it. Don't just go to anyone you feel you can go to. It's going to make you waste a lot of money, and at the end of the day, you come back and then you spend more. What are the leading causes of female infertility, and can they be avoided?
So We have already talked about leading
the
causes.
leading causes.
Now,
Maybe avoided.
avoiding these things or trying to prevent them, it's I will just take 5 out of. There is a video, short video I did about 13 life hacks
Okay.
to live a good life and to prevent diseases, to go healthy so that you can save a lot of money. You don't need to spend so much. I'll just take about 5 of them. First, you need to eat healthy.
Okay.
Are you getting it?
Yeah.
Then we cannot overemphasize this statement about avoiding smoking, avoiding binge drinking alcohol. We can go over and over on the pathophysiology, how these things are linked, but it will waste a lot of time.
Okay.
But I can assure you that smoking, alcohol will appear in so many diseases because of what they do in your liver and some other part of your body. So you avoid smoking, then you seek help at the right time. Take good care of your health. Do regular medical checkup. Are
How
you getting
often should that medical regular checkup should be? When you say regular, how often? Is it every month or once in 3 months?
Well, regular checkup, that can be dependent on age, on any medical condition you come up with.
Okay.
For ladies generally, there are basic things that lady needs to check at intervals.
Okay.
We'll talk about
When are they supposed to do the check?
When?
Yeah, when I'm talking of the frequency. Is it in a month or 2 months or 3 months or 6 months? Like when it comes to
There's
dentist.
a collection I gave a name like Well Woman Package. Well Woman Package.
Okay.
Like it includes the pap smear.
Okay.
Pap smear, for instance, is supposed to be done once in. Some will tell you is this related to infertility, but it's a package, Well Woman Package. Pap smear once in 3 years if you are doing the typical pap smear, or if you are doing the cervical screening combining HPV testing with pap smear, you can even do it once in 5 years. So then you can also check your womb, like do your abdominal scan or pelvic scan, as the case may be, once in 6 months. You can also check the breast scan.
Is that related to infertility?
Not. That's why I said it's a Well Woman Package. Women are special beings, so it's a
what
Well
about
Woman
men? Men are not special.
Now, test to do. There is no specific routine screening or check that you will be doing regularly for infertility.
Okay.
There is none per se. The most important thing is your knowledge about your system, is your knowledge about your body, understanding your cycle. So in a nutshell, it is advisable for you to check your health regularly. So it's not like you have a specific thing to check when it comes to. A lot will be reviewed when you are doing your maybe 1 in 6 months pelvic scan and all of that, among various other tests to do. So now, what to avoid? We talk about it, smoking, alcohol. Stress is something you need to avoid, and that's why I started with mothers, fathers, society, friends, folks that put pressures on people. Once they get married and you start looking at their tummy, you want to see the following week if they're already pregnant. So stress, anxiety, they are counterproductive. Even when you are taking medication, you are trying to achieve conception. If you are stressed, you are not relaxed, it can also be counterproductive. So I think that's about it. So, and these are the things I've already mentioned among the 13 lifestyle hacks to improve your health in my video.
How true is it that weight gain and underweight is also a factor that can lead to infertility?
So that's absolutely correct. Weight gain. and weight loss, particularly because there is a connection. There is something that is inside fat that has a link between that interferes or that can connect with what controls the hormone that leads to ovulation. So this is more so when you are of average weight and suddenly your weight shoots up,
Okay.
or you have average weight, suddenly your weight comes down. So it as a way of
Shifting something out of where it should be.
yes, in
Yeah.
your hormonal milieu that will not disturb your ovulation. So the same way mood changes, the same thing we're talking about anxiety, same thing we're talking about stress, they have an effect on the higher center that controls and regulates ovulation.
Okay.
So, and one of the things I usually see on the internet too, a lot of people make noise about hormonal imbalance.
Oh yeah, yeah.
Hormonal imbalance, hormone is not always constantly balanced. There is a way it changes with respect to so many things. So for me, hormonal imbalance is not a diagnosis. What makes the hormone imbalance?
Imbalance.
That's the diagnosis. Why don't you pay attention to that? So much noise. There are a lot of drugs they are now selling for hormonal imbalance. I do. A lot of junks out there. So that's that as far.
What's the recommended weight that someone should have?
So when we talk about
fertility?
weight, we talk in terms of BMI, body mass index.
Okay.
So it's always good to be to fall within the average body mass index, which is between 18 and 25.
Okay.
So body mass index is measured in weight in kilogram
Okay.
over your height in meters squared.
Oh.
So whatever you get, if you are getting less than 18, it means you are emaciated, you are very slim, your weight is too low. Then if you are getting between 18 and 25, that's very good for you, for everyone. About 25, then you'll be talking about overweight. Then when you get to 30, then that's obesity. You're already getting obese. And,
yeah.
you know, and the eagles.
But funny enough, sometimes you see people who are so big, as in weight, but they get pregnant.
So
they
that's
give birth.
that's the question. I was talking about, you know, the sudden change, the weight thing. When there is this sudden change, that's when it distorts your hormonal milieu and makes it disturb you from ovulating. So if you have a particular steady weight and your system has adjusted, you're ovulating. So if it suddenly increases or if it suddenly drops, then it can distort your hormonal milieu. However, at the same time, those that are having all these things too, they talk about probability, you know, chances, you know. It doesn't mean that, okay, when your weight is this, you cannot get pregnant. No, it doesn't mean that when you are slim, you cannot get pregnant. But the chances, if everybody has a 30% chances of receiving conception per cycle, when your weight is there, maybe it drops 10-15%. But there is still pregnancy. You can still get pregnant. So,
you know, information is really key. You need to have the right information to, you know where you stand actually. So at what age should a woman check their fertility level if they are fertile or there is infertility issue? So for them to start dealing with before they get into marriage.
So generally I have issues about being duly conscious and sensitive about infertility at, you know, at what age do you want to start getting pregnant? So, but really, if age is a factor, it's a huge factor in fertility. The peak time a lady can easily achieve conception is in the 20s. So fertility starts to decline gradually, slowly. When you get 30, you know, 35, becomes significant after 39, 40.
Why?
So that's we've done a program, we talk about a biological ticking clock.
Is that thing real? Because I hear a lot of people say that clock is ticking.
Yes, it's very real. It's very real. There are various factors that make your fertility drop. One of it is that in God's wisdom, as wonderful as it is, and it creates woman as a wonderful being.
Okay.
Do you know that the eggs in a woman is already fixed by God as you are coming out?
Why
of
is it that a woman of 65 years old will still have a baby? It's happening now.
Bring the evidence. And it's not through IVF.
No, natural. I've seen people that have said it. They did IVF,
They
it failed.
said it.
Yeah, they did IVF, they failed. I saw a woman last week. The woman had triplets. She said she did IVF 5 times. It failed. And she told God that she's not going to go for IVF anymore. She just wants to trust God. And she got pregnant.
Well, we don't want to challenge God.
Oh.
And we don't want to challenge even man. The age of menopause, the age range of menopause is between 45 and 55.
Okay.
And then the average is 51. Okay. Once you're 55, 50, 60, you're already menopausal. Let me give you the facts. Apart from the fact that your egg is getting depleted as you are aging and it is completely exhausted when you become menopause. As you are aging at 35 and above, the quality of egg is also dropping, given the chances of chromosomal abnormality. In a nutshell, I will advise every lady in their early 20s to have a gynecologist, to establish a relationship, to check their health, and also discuss fertility goals. Not necessarily investigating or checking how fertile they are.
Yeah.
So you discuss, you can be well informed, educated about your body. I used to give an example of how I became a gynecologist. As a secondary school, I finished a book called Every Woman.
Okay.
A book that described every part of woman. I didn't know what, I got it from a colleague or a friend in class, and I picked interest. I finished the whole book, Every Woman. I didn't even know I was going to study medicine then.
Wow.
So I ended up a medical doctor, and I ended up as a gynecologist. So that Every Woman, for teenagers, when they read it, it tells them about their system. They can understand, they can relate to the system. Even with every woman, you can need the guidance of your gynecologist. Without every woman, your gynecologist can also guide you and teach you certain things about your system, about your body, how to even prevent the entity called PCOS. Because sometimes the mild form can do some lifestyle adjustment and you're still good to go. You not even know.
Wow.
And there are people that have achieved conception, deliver 1, 2, 3, 4, and with evidence of polycystic ovary. So early 20s, establish a relationship with a gynecologist, and you not regret you did.
Excellent. Now, how would women take care of their body in preparation for conception in marriage?
Wow, that's a beautiful question. There's an entity called preconceptional care.
Wow.
In this part of the world, a lot of people get pregnant and say, oh, it's a mistake. Why quite a number of people are anxious of pregnancy? They want to quickly get pregnant.
Yeah.
Pregnancy is supposed to be prepared for. So this question addresses preconceptional care. There are certain people with medical conditions.
Yeah.
There are some medical conditions that do not even allow you to get pregnant. There are some medical conditions that allows you to, they allow you to get pregnant. And when you're pregnant, they don't allow the pregnancy to thrive.
Wow.
Or it can even be a burden on you, and it may make the condition worse. So preparing for pregnancy requires you ensuring you take adequate care of your health. Any medical condition, take drugs. If need be, adjust some medication because you're preparing for pregnancy, and take some drugs, certain drugs that will boost that will optimize your body in preparation for pregnancy. So the question is addressing an entity called preconceptional care, and you can best do that by consulting with your doctor.
Wow, that's great. So how useful is a gynecologist to both women and men when it comes to the issue of conception, fertility?
While I agree that it's not necessarily only a gynecologist that can handle what we call the preconceptional care. We have talked about preconceptional care.
Yeah.
The gynecologists are there for you to take care of that for you. Even when you are pregnant, when you are desirous of pregnancy, gynecology is there for you to take care of all of that. So, talking about how useful they are, the need for a gynecologist in life with baby cannot be overemphasized. You know, especially with what is going on here and there now, with the incidence of infertility, incidence of polycystic ovarian syndrome, endometriosis, uterine fibroid. So there are so many. You need guide. You know, you need guide. A lot of restrictions here and there. So you need appropriate care. You know, there are things you can even do to prevent it. If you don't know, you will not. I mean, it's simple. The knowledge is power. And you can't get the knowledge, you know. So I've Googled it, I've checked it, you don't Google your symptoms, you get crazy, anxiety get worse, you start. So gynecologist is an expert, medical expert, they're going to provide that guidance, support. So the list is endless.
So what's your mantra?
Quite a number of them. The major one that a lot of people play around with, health is wealth.
Good.
Then there is this one that, okay, you need to empower women so that they can take charge of their own health.
Wow.
Then I also say go healthy, save a lot of money.
Wow.
So going healthy, doing basic things help you to be in your optimal shape, and then you save a lot of money.
I will go with go healthy. That will save you a lot of money. All right. What's your pathway to success? Pathway to success.
We've said it before,
Yeah.
and I will still say it again. Determination,
Okay.
focus, and then having a curious mind all the time. You know, trying to get solution to every problem that comes your way. So that's just basically it.
So finally, doctor, I want you to look to the audience and advise someone who wants to become a gynecologist. Person sees you and say, oh, he has this knowledge. I'm kind of thinking of being a gynecology because I just love what he does, how he, gives help to people and their problems are solved. And this person is saying, I want to be a gynecologist. What would be your advice? Because there are many out there watching you right now.
Let me say this. One of the reasons I'm still with us here in this environment is because I have strong passion to be a gynecologist. So follow your passion. Stay curious. That is the path that leads to finding new things. So I will advise, stay focused, follow your passion. Gynecology, especially for women, it can be very tedious, not difficult. I don't use the word difficult. Can take your time, can take your, you're always on the move. Your average clinic day, it's almost like an emergency day. Every call day is always almost emergencies. So if you're not mentally ready or alert, or if you're not passionate about it, you get burnout easily, and then you can get frustrated. So, follow your passion, stay curious, and be focused. That's it's not difficult, but it can be.
It's achievable.
It's achievable, but it can be demanding. Let me use the word. Then, above all, as doctor, generally, people should learn to prioritize patient care. We should find a way to draw the line to business and the care of our patients. And the upcoming gynecologists also should bear that in mind. I don't know if I've spoken to anyone.
You have done that. Thank you so much, doctor.
My pleasure always.
I'm happy to have you here, and you have done so wonderfully well today.
Thank you for having me. Thank you for having me. Yeah. And we should thank the listeners for listening.
We thank you, the listener, for listening. You have heard it all from Doctor. He's a gynecologist, as I've introduced him earlier on. He has given us all that he wants to give to us now. That's not the only ones he has. He has so many of them. But because of the time constraint, that's what he's able to give today. We're going to come back another time and you will have more from him again. Stay cool, and please don't forget, adhere to what he said and do as he has instructed, because you will be happy. And drop your comment if you have any question. Thank you. See you again.
Thank you.